And so how do people classify psychological disorders? Well, let's talk about why first people need to classify psychological disorders. And there's several reasons. First of all, we understand that there's certain commonalities between disorders. They're not all very, very different. And so by understanding what's similar, we can kind of group them in larger domains. That people who are, for example, very anxious would be, or different kind of anxiety-related disorders would be grouped together. This helps with treatment because illnesses with similar manifestations, similar ideas, can be treated similarly. And secondly, when you're able to categorize disorders, we could really map out and predict what could happen next. As to say, we could kind of figure out what goes together. For example, people who are depressed usually often have different kinds of explanatory style. These are kind of symptoms that go together. So by understanding what go together, we understand what exactly we need to treat. And finally, we could predict the outcome, like what, if it's a degenerative disorder like schizophrenia, what are some of the stage and milestones people hit when they come to that kind of illness. So basically, helping us, categorizing these illnesses help us diagnose and treat these illnesses by saying that looks like other people have these illnesses too, or you could pick up the symptoms and kind of group those symptoms into the proper kind of diagnoses, and also could predict what's going to go on and what kind of treatment is going to help someone with that kind of disorder. Now, right now with clinical psychologists, they have what we call the DSM-4, which is basically a diagnostic and statistical manual of mental disorders. That's the acronym is DSM. Now it's in I think in 1990 came out with its fourth edition. The fifth edition is coming next year in 2011. And so they're just going to have a lot of updates on the mental disorders. And so a lot of the mental disorders have actually changed at the past. One of the most striking one is the Re-Categorization of Homosexuality, where in past editions, like the DSM-3, being gay was actually a mental disorder because it was seen as deviant and also disruptive and also distressful. Of course, people always change and update these because they found that being gay is really just a cultural, it's just a cultural situation. So they actually delisted it as a mental disorder, even though they now understand that a lot of the stress and a lot of the social unpleasantness that comes from being gay, being excluded, being made fun of, can actually lead to mental illnesses. But being gay itself is not. So in between editions, they actually change and update a lot of these disorders. So for example, I've been listening in a recent discussion about whether internet addiction should be included in the DSM-5. Basically, these are kind of newer ways of how technology and society has changed to include that. I want to talk about the criticism of the DSM-4. And so people have been not very happy about, for those who have not been very happy about the DSM-4, they kind of understand that the DSM really doesn't help mental illness because first of all, it treats everything like an illness, like a disease, like an abnormality. Secondly, it seems very inclusive, such that a lot of little things are included in the DSM-4. For example, periods of brief irritability. If you have like a fear of heights, like a mild fear of heights, mild fear of social phobia, so on and so forth. These little things are kind of also lumped together. So it's kind of easy to overdiagnose people by including these basically minor, non-harmful behavior into the DSM. Let's talk about how the DSM is organized. And so in order to diagnose someone with a psychological disorder, it's really based on a series of assessments, interviews, and observations. And usually multiple clinicians have to diagnose it in order to understand it. And so there's basically 5 questions people ask, and they go through this book, when they want to diagnose someone's disorder. The first one is what we call Axis 1, and it asks, is a clinical syndrome present? So basically ask questions like, we're going to go through the different kinds of mental disorders. So things like anxiety, is there mood depression, hallucinations, are there depression? For example, these are the clinical syndromes. Secondly, is there a personality disorder or mental retardation present? These are additional kind of filters we have to go through. We're going to talk about what personality disorder is, and later on mental retardation. We talked about mental retardation in the previous class. The third question they ask in Axis 3, in a series of these questions, is there a general medical condition, such as diabetes, hyperventilation, arthritis, stuff like that, is that present? That is to say, whether mental illnesses and physical illnesses go together, because it might be that the physical illnesses are causing mental illness. For example, illnesses such as syphilis have a kind of a brain component on how it manifests itself. Are there psychosocial and environmental problems such as school or housing issues also present? So they also take into account the environment of the person, whether in this particularly stressful lifestyle, whether the family has a stress, if their environment is problematic, because those are the things that could be causing these psychological disorders. And finally, what is the global assessment of this person's functioning? So basically in the global assessment, they're assigned a code where they are asked to see how well they could adapt to life, how well they're functioning. And so on us, for example, if you're on the higher end, we have superior functioning. That means life's problem never seems to get out of hand. You're kind of very well adjusted. On the lower end, on 1 to 10, if you score on this 100-point scale, 1 to 10, you're saying that you're in danger in your life because you might be self-harming or putting yourself in harm's way, or just so low functioning that you can't really take care of yourself. And so you could score anywhere between low functioning and high functioning on this global assessment. Okay.